Good evening and welcome again to God's Plan for Better Health series. Me, Dr. John Scabo. Thank you for joining me again for Intel Discover, Plan Blong God for Health Blow You and Health Blow Me. Long today, ba Intel talk about diabetes. Diabetes o sikisuga ay may one for a very big problem inside lang country limi. And him now one for a main siki where because him stuck people for sleep hospital, stuck people for losing lives blokata, and stuck people become disabled because otang go blind, or stroke, or garim heart emi fail, or kidney emi fail. Diabetes emi one for a sickness where time sugar level lo body system emi higher than the usual or the normal. In normal, tayo tala hangere o intan no kai, the level of sugar emi should be less than 7 millimoles per liter. Or suppose intal kai, emission be less than 11.1 millimoles per liter. So, tayo migarem si sugar or diabetes, emi simply minimosem. The level of sugar emi above 7 millimoles per liter, tayo intal no kai, and am also above 11.1 millimoles per liter, tayo intala kai finish. How naman mi sabi that migarem risk for developing si sugar? Well, these are the behavioral risk or the life choices risk where I'm by making in the langarem siki sugar. Suppose in the overweight and obese, well, pa risk ya, chance po garem sugar emi higher. Or suppose in the non doing enough physical activity. Or diet blin to falla, emi not healthy or simply minimum. Suppose in the kakaim too much na rice within flour, bread, noodle, or kay blong stoya, then chance po siki sugar aiming go very high. Or suppose imi garem siki high blood pressure, or in the ready for garem high blood pressure, imi call it pre-diabetes. Or sometimes you mi mommy or you mi sister where time you mi bambule or you mi garem pikinini, they not find him sugar blin tala emi higher. Imi call it gestational diabetes. Tayo talang garem sugar im high, tayo talang pregnant or garem baby, the chance po idal garem siki sugar im also go higher. Or sometimes you mi garem family history, you si oh ma daddy mommy garani o watan na garem siki sugar. Then im increase him chance po intala for developing diabetes or siki sugar. But on that part by mi kentokosin. Because family garem siki sugar, em no minimo by always yumi garem siki sugar. Having a family history, emi put him at higher risk, but intala sabi postpone him or prevent him siki sugar po come up, suppose intala adopt him healthy lifestyle. What now what the signs of diabetes? Start time diabetes emi can be silent. No any sign long em. Unless level blood sugar bar are really high. If sugar emi above 15 or 20 millimoles per liter, before ba intal sabi garen sample sign. Or if intal developing complication or problems. But these are some early warning signs where emi good for intal must look out for it. Sign number 1. Suppose intal finding that intal have to go and frequently passing urine. Emi disturb intal on night that 12 time low, one for a day or one for a night, emi normal. But suppose you find him that emi disturb him sleep, that he'll have to go out in water or maybe more than 3 times a night, diabetes can be one for a sicky where emi can cause him that one. Or intel sa finding, intel drink water by intel thirsty all over normal. Diabetes, emi one for la where emi give him that a sign. Or intel kai intel full, but intel sa feel him intel hungry all away. Or it'll find him that it'll plan for lose weight, but time it'll body size a biggie, then eventually it'll just cut down straight very fast. Diabetes, TB, sikim blood thyroid, cancer, or siki wesa making me lose weight. Or intel sabi garing problem lo eyes. Several time intel might say, oh no ma, I'm lo me look good lo several time. But several time no ma, I'm no clear, me fluctuate, me up and down. Time sugar am up and down, and we can cause him that one. So we assign blood diabetes to that one. O intala feel him tired. Intala kakaya finish. Intala expecting po garem energy, but then intala finding that no, ma intala feel him tired. O intala garem one fala soa welo leg plint fala. Intala go dress him, do him any kind thing long him, but soya no sabe heal up. Diabetes is a common thing where we make him yumi sabe garem soa no sabe heal up. Diabetes suppose intal no control him, by causing problem lo body blend fala. And that a problem and relate with him the level of sugar. So what a common problem where diabetes cause him na is we can cause him problem lo eye. So by intalang go blind, so we damage him straight na eyes blind ala, permanent blindness. Or we can block him blood pipe lo brain, so then eventually intalang garem siki stroke. Or if we block him blood pipe long heart, then intalapay garem siki heart attack, that eventually heart emi go fail. So heart emi fail, intala become disabled mo. Or emi can damage him kidney blo into ala. Or emi can damage him na, or ta nerves blo into fala. Therefore, what na him happen? Nila pokpokya, so go eventually emi go numb. Intal no longer feel him anything, no matter intal step him nail or step him fire or anything long there, but intal no feel him. Or diabetes time emi no control, then emi cause blockage blong blood pipe, blong leg that gongo skin color blong leg ya emi go change. Color ya manya em light skin, but intal notice him that gongo emi go black now. Or time em evening come, intal find him leg emi sabe cold na emi sabe come up. It's because the flow of the blood lo leg, him not make him warm, but time emi reduce, then emi cause him problem that it'll say feel him coldness po come up, or emi say cause him numbness lo leg, or emi can damage him parts lo body. That is if siki sugar emi no control. Time em come lo management belong siki sugar or diabetes. Management plan belong tala the target is you need to control him na sugar ya. Because if sugar are no control, and may cause him complication or problem where intel talk about him can finish. Heart attack, stroke, kidney problem, eye problem on leg, so ano heal up that eventually go leg and go cut. Sugar na main thing and drive him na every problem. So what na actually happen? Well, time sugar emi high, body converting that sugar into grease, emi call them cholesterol. Or the sugar itself, emi pang toxin or emi pang poison, where emi can poison in body, so emi causing what emi call them inflammation, so emi damage him na what the cells belong or the blood pipe. And grease come on top, then emi block him. So time blood pipe lo brain emi block, stroke come up. Time blood pipe lo heart block, heart attack come up. Time blood pipe lo kidney emi block, kidney problem come up. Time blood pipe lo eye emi block, blindness come up. Every problem where we relate with them diabetes and we relate with them effect block sugar, either as a form him grease so we block him, or a poison so we damage him cells so we come up on that. So it's important po itala mas managing diabetes. Time we come lo managing diabetes, we minimum sem tu pola menting noma. You use him tablet medicine, blow white man, or you may use him lifestyle. If you ask me which medicine na emi true for the medicine for diabetes, me can tell me osem lifestyle na emi real one. So emi osem intala must adopt him a healthy diet. Intala must stop him smoking. Intala must stop him beer, stop him bitol nut. Intala need to be physical active and exercise. Suppose intala overweight and obese, intala need for losing weight. Also, intal need po regularly go and follow up with them or the nurses and doctors blintala no NCD clinic. No can miss him appointment right? Because every time you walk in the clinic, what na by the nurses and doctor do him? You may screen him you for the complication. You may check him. You got a problem na this time or normal. This is why it's important no can miss him appointment lo. Go to the clinic so that our nurses and our doctors can continue for managing into hala. Time em come long treatment for diabetes. Emi garem for la key no more treatment targets. Sugar, you must control it. So you listen come. If you garem siki sugar or you garem a family member you garem siki sugar, time you treat him diabetes target is sugar must less than 7 hem na best. But suppose sugar blowing tala emi between 7 and 8, emi alright, emi good, but you know good too much. If sugar emi stay between 8 to 10, that's a fair control, emi alright, but you know good too much. But suppose me more than 10, that is a poor control. Basically, what I mean is, time sugar emi more than 10, there is a higher chance body by changing that sugar into grease than by damaging cells the body, and that's how I come up with them the complication. So number one target low diabetes management is we must control the sugar and aim best for less than 7 millimoles per liter. Number two targets low every diabetes blood pressure blowing the la must be controlled. That the control of the blood pressure minimum must be less than 120 over 80 no can above that. Number three targets po it'll achieve him, it'll must maintain him normal body weight. Body mass index you range between 18.5 to 24.9. You must put him that body weight within that normal. Suppose like po sabi, what na ideal body weight you? You take him height you, if you measure, then you 170 centimeter, you minus him 100 na 170 here, but you can end up with him 70. So minimum if height you 170, you should be 70 kilo na ideal weight. Suppose in the 160 centimeter na height, then minimum in the should be 60 kilogram na lo ideal body weight. So that is in terms of the ideal body weight. The last one target or the fourth target lo managing diabetes is po intal need po control him na cholesterol o grease. Whether him sa mesam grease or noma, if intal control him the sugar, indirectly intal can control him the cholesterol. Challenge blim Solomon Island is in nungaren in chemicals or machine where him sa mesam cholesterol, but you no can worry. As long as intal control him sugar blow you, by intal sa control him no ma cholesterol blow.